Sure. Hello, everyone. We've done a quick sound check, so I think we should be okay for audio, but if anybody could give me a thumbs up. Oh, there's Tatiana, thank you. We'll give our colleagues just a few minutes. We had a great response to this data challenge. So we'll give people some time to join. Okay, colleagues, we're starting to get some good numbers here. It's 1 minute past the hour. So we will give everybody just 1 or 2 more minutes to join, and then we'll get the webinar underway. I'm just checking to make sure all of our speakers have joined today. I think I see everybody. Okay. Noting that it's, late in the day for some and very early in the day for others, we're going to get our program underway. This is our 5th Primero Data Challenge. Welcome to everybody. This is the first of the year, so we're sort of a little rusty after being away from our computers a little bit over the past little while. What we're going to focus on today is pretty interesting and exciting stuff. We have some really interesting themes to discuss today. I'm going to get the ball rolling. I'm going to just go over to our slides here, make sure that everybody can see as we move through these. Mamadou, if you could confirm for me when you see the deck up, please. And here we go. Yeah. Okay, let me go to full screen here. So just for everybody's information, we are recording this. We do publish all of the data challenge content online. So this session is being recorded. Excuse me for a moment. As I mentioned in the chat there, we're coming to you live today from Accra in Ghana. We're working, I've got the wrong display setting up now. We're working here directly with the ministry colleagues who have joined us today. We're at UNICEF country office in Ghana. I'm going to start by introducing our agenda for today. Quickly, we're going to do a round of introductions of our speakers before they get underway. I'll do a quick walkthrough, a refresher of the Primero Data Challenge. how it works and what we're trying to achieve. And then we'll throw the microphone over to our colleagues to hear about these interesting implementations and problems that we're trying to solve with Primero, and get your thoughts and your feedback on all of these. So moving right along, what is the Primero Data Challenge and what is it for? So really, this is an initiative that bubbled up from our own community at the global level. We received so many requests for support, and we realized that so many of our partners were sort of facing similar issues. This is really all focused on data usage, on improving responsible, effective data usage. And we're really focused on programming insights and how we can improve and do a better job by using the data that we have. We're also all about sharing experiences and building our own community, sharing capacity. I think that that's been a really great takeaway from the first year of the data challenge. We have a lot of teams collaborating directly with each other, sharing the resources that they have and inspiring one another. And finally, we want to be able to identify and make informed decisions about investments in Primero products and services. And I'm going to talk a little bit about that at the end of today's data challenge. The overall goal, better results for children and survivors of violence through better use of data. So quickly moving along, how does it work? We're going to do one webinar per quarter. We're going to be progressive and participatory. So we want to be building on the previous editions of the data challenge, and kind of growing our own capacities, and as we identify gaps, filling those gaps. We want to be focusing on a specific set of challenges in each webinar. For this particular webinar, we have a bit of a mix of things. So we're going to hear a little bit about some specific challenges from a refugee setting. We're going to hear about a nationally scaled government-led implementation and some of the issues that they're facing there. We're also going to hear about some of the core UNICEF or some of the core Primero team issues with our own KPIs and reporting on the health of Primero as a platform. And we'll hear from our colleague who's a disability inclusion specialist on the child functioning module for disability classification. These are the themes for today. We want to create incentives for this responsible use, and we want to reward the winning contributor each year. So in the first year of the data challenge, the Cambodia team was able to select a feature as a result of being voted the best submission for the data challenge. We're going to be delivering that feature in the next few months. Everybody will benefit from it. We'd like to see you be the next winner. And all of this content is being curated into online knowledge products. You can catch the link on the bottom for the Google microsite for the 2023 data challenge. So responsible data for children, this is just a shout out because we are still trying to kind of promote this community of practice. Go check out the website if you haven't done it already, rd4c.org. This is all about what makes children's data unique and different from other data that we might be managing. They have a very specific set of risks. They have a very constantly evolving data landscape. We gather a lot of data about children, and so we have to have a principled approach to it. The idea for RD4C is to make this as friendly for usage in the field as possible. So, not really complex stuff, like very clear messaging, very easy to take to the field, share with your partners, emphasizing the difference between misuse and misuse. When we say that, we mean having lots of data and not doing anything with it is its own problem that we need to address. So that's my quick summary of the background of RD4C and the Primero Data Challenge. The next thing we're going to do is we're going to jump into this very specific work that's being led by UNICEF and partners in Dadaab. And we're going to look at this specific question about what kind of data issues do we face in one of the world's largest refugee settlements. So, Kevin, are you on the line?
Yes, Robert, I am on the line.
Okay, great. We hear you loud and clear. I'll control the slides for you, Kevin, but what we'll do now is we'll just get you to introduce yourself, tell us one or two things about your work, and then we'll get started with your presentation.
Okay, thank you, Robert, and good morning, good afternoon, and good evening, everybody. My name is Kevin, Child Protection Officer working at the Kenya Country Office and supporting the Dadaab refugee camp. My role is mostly on emergency and disaster risk reduction, working and supporting emergency counties, 6 emergency counties covered by the Garissa Zonal Office, which is one of the zonal offices in Kenya. So Dadaab is one of the areas that I usually cover. And just a brief profile of Dadaab. Dadaab is a refugee camp that hosts more than 330,000 refugees and asylum seekers. On top of that, we also have just over 25,000 other unregistered persons who have come to the camps, mostly due to drought and other issues from Somalia and other neighboring countries. Of these, 55% are children who are our clients on day-to-day basis and who we support on a daily basis with case management and, of course, our clients on CPIMS Plus. If you could go to the next slide. Yes, in Dadaab, we have CPIMS Plus. We started using it in 2022, but just before 2022, we used to have CPIMS Legacy, which was an Excel form, a tool that we used or we've been using from around 2016 to do case management. And it was more of paperwork and data entry into Excel, into Word, and all that. But from 2022 March, we moved to CPIMS Plus after a lot of learning from our instance in Kakuma also, which is another refugee camp. And so far, we've had 70 case workers who are using the system. And these case workers are based in Dadaab, and they are from our partners, Teredezom and Save the Children, who have been our key child protection partners in Dadaab, supporting children from the refugee community and even the surrounding host communities. So far, we've had 11,456 cases entered into CPIMS Plus, and these are the number of children who have been supported, who have had different protection concerns. Next slide. So for the system, we have our partners who use the system directly from the registration of cases all the way through the case management process. And then we have UNHCR and UNICEF who use this system to do the reporting, and we can only access the reporting bit. So we use these reports and we download these reports and use them for our regular updates in terms of monthly reports, quarterly reports, annual reports, and even our donor reports. We usually use this. And from the 11,000 cases that are in CPIMS Plus, from my left side, you can see out of these 68.85% have been closed, and we are having open cases of around 31%. And in terms of girls and boys, you can see it's almost equal, but boys having 5,900 cases, and for girls being around 5,470 cases. So that's in summary what's there in CPIMS Plus. And within these children, or the children that we are supporting, we've had 111 children who have been resettled to third countries. Of course, we've had others who have gone through other best interest determination, and some have voluntarily repatriated back to their countries. We've had 270 bid cases also, which have been processed, and children who have been supported. And then we've also had 194 best interest assessments done for unaccompanied and separated children who have come into the camps, and are currently, all of them are currently supported, and they have either been placed in families. Some have been reunified with their biological parents or the primary caregivers, while as I mentioned, the others are with foster parents, with relatives, with uncles, aunties, and such. Next slide. This is just some of the good experiences and stories that have been shared from the field. I'll not go through all of them, but maybe just as Robert mentioned, it will be shared within the CPI, within the Primero Data Challenge, so you can be able to go through the stories. But I can read the first one, where CPIMS has not only improved efficiency of the teams, but has also enhanced communication and collaboration with other protection partners for referrals, because within CPIMS Plus, we have a function for referrals where partners are able to refer cases to within the partners who are using CPIMS Plus, and even those who are outside CPIMS Plus, and we are able to update it once children receive services. So in terms of what has worked very well for us, we feel that the system has made case management more efficient and very effective, because when the case is entered, all the details are there, and if you want to even come and review these details, you can be able to come and review them as a case worker, as a case manager, and even the other users of CPIMS. And in terms of the data quality, it has really also improved because of these many reviews, many checks, and the support that is also provided. Because from where I sit as one of the administrators, when I see maybe the data is not as good as required, or if there are challenges, then we sit down as a team and we come up with recommendations and way forwards. And part of it is usually capacity building, where we continuously build the capacity of the users of CPIMS Plus. The system has also really enhanced data security and data protection, because initially when we were using forms, the offline forms, that is the paper forms. These forms were put in offices. The offices were closed, but in terms of security and in terms of that data being accessed by anybody was really not much secure. But as it is now, because each caseworker has their own login details, and the data is protected, and even in terms of security, because the emails and the access is also pegged on the partners' email addresses. So it's also very secure, and we are able to really access this system in a very secure and in a very protective environment. In terms of availability, CPIMS Plus has also been available. We have an offline and online online and offline features, and this has enabled the caseworkers, when they go to the field, when they go to the camps, when they go to the households, they're able to really collect all the information that is required, even when they go for home visits, when they go for follow-ups, and all the meetings that they do with the caregivers, with the children. They're able to record it very effectively in the field, and once they are back to maybe where the network is available, or even to the office where the Wi-Fi is available, then all this data is able to be uploaded automatically into the system. And the data is real time, where cases that require approval by case managers, they can be able to do it effectively and immediately. If you compare it with the previous system, where the forms had to be printed, to be filled in the field, sometimes even case workers having to carry those files back to their room. Sometimes these files got lost. Sometimes the papers also got lost. In terms of approvals, it was also piling a lot of work for case managers, because they had to go through all these papers and approve the different cases. But with the current system, it's very effective, very efficient, and it has really made work very easy for case workers, for managers, for the coordinators, and everybody that is using the system. And as I mentioned, it has really improved the data quality, and in terms of the protection, even because when somebody requests for information or for data, then this one is easily shared. Then non-identifiable data is shared easily. And even in terms of the support we receive, not only from the users, but even the other child protection working group members, in terms of improving the system, in terms of coordination, in terms of referrals, has really worked positively for us. Next slide. Of course, with every system, there are some pain points or some challenges that they come with. From where I sit, I just identified a few, or just 4 areas that have been challenging in the system. One is the high staff turnover from our partners, because after every maybe 3-4 months, we see new staff coming in. staff that we've really invested a lot of resources to train for them to access the system. They leave, we receive new staff, and we have to go over through the trainings again, taking them through the terms of use, taking them through the data protection protocols that are there, and many other requirements that we do before they're able to access the system. So this takes a lot of time and a lot of effort that would have otherwise gone into doing more case management. The other one is system downtimes. Downtime. Sometimes the system is down. We are not able to access the system, and case workers once in a while they've also been raising this because they go prepared, go to the field when they want to start case management, when they power on the machine and try to log in. The systems are down and they are not able to now do case management or do the activities that they've gone to do in the field. So they end up maybe coming back to the office or waiting for a long time so that the system comes up again so that they're able to continue. And then the other challenge is limited resources for case management. Case management really requires a lot of resources, from human resource to equipment, to the training that I mentioned, and to many other things that go along with case management. And the resources that we have been quite limited because, of course, of the limited funding that we receive. And this has been able to support, but there are many gaps that we still have in terms of the challenges and in terms of the resources that are required. And then the last one is the requirements, especially for me when I am required to do reports. I have requirements to do many types of reports. Sometimes the reports require only number of, let's say, children who have undergone gender-based violence within a certain period, maybe between October and December, and I'm not able to really get this from CPIMS Plus, and I have to call the system administrator to support me in terms of downloading the monthly data and all this. And I believe it being a system that is real-time and a system that I'm able to access, it should be easy for me to get the different types of reports with filters, with everything that will really make my work easy, so that I also don't have to eat into other people's time requesting for reports that I should basically be accessing. And then just so to summarize in terms of how the different teams have been using the system. Of course, as I started, I mentioned terrorism and Save the Children. They enter the cases. UNICEF, UNHCR, we are able to access we are able to access the reporting bit, and part of what we are required to do is to support the caseworker. So one other thing that I'm really not able to do within the system is to see data like from how many caseworkers have worked on a case, let's say in January or February, see maybe where the gaps are within the cases. It's something that is still not very clear for me within CPIMS, and I'm not able to provide that adequate support. I have to call for a meeting, sit down with the different caseworkers, see the challenges that they have, and then organize for or have a tailor-made training for specific issues that are maybe raised by the caseworkers. And as I mentioned, the specificity of the reports that are required is something that I will really want the system to be to really support me in terms of getting the required reports so that I'm able to download, do the analysis, and summarize my reports. Yes, thank you. I think this was the last slide. Next slide, let's see. But I think this was the last slide. Yes, thank you.
Thanks very much, Kevin. Like, this is a very, very unique context with very unique challenges, but I think there are probably lots of our colleagues that have similar challenges in the context they're working in. I'm going to open up the microphone for anybody who wants to ask Kevin questions. I think he's identified some pretty interesting topics here. I have a colleague here in the room. Please introduce yourself and go ahead and ask.
Thank you, Robert. My name is Kingsley Ghana. I was finding out he made mention of the system downtime. I want to know what account for. Is it because there's power issue, there's internet issue, or the server goes down, or the server itself that might be down? Where are you also hosting the CPIMS in your country? Thank you.
Yes, for the country CPIMS plus it's currently hosted. I think it's the cloud Azure, but Robert can be able to really specify where it's hosted. But it's a cloud-based system for us. And in terms of the system downtime, one is the CPIMS plus system itself. Sometimes we are not able to access. When you try to log in, it logs you in and then it logs you out. Or when you try to log in, it just goes round, and does not log you in. Another one also be Dadaab being a very remote area. Sometimes also the network is also not very good. So that's also one of the reasons for the downtime. But otherwise, those are the two major ones. I can see in the comments, Nangar has also asked where the data is stored, and yeah, Robert will be able to maybe provide more details on this. And then is the CPIMS connected with Kenya Social Protection System? No, it's not connected. We have the Child Protection Information Management System, which the government is using. So they are not interoperable at the moment, but it's something that we are discussing with the government to see how we can also be able to support them to upgrade from the current CPIMS that they're using, because it's a bit, compared to the CPIMS Plus, it's a bit behind, and we would want to support the government in terms of improving case management, including now for the hosting country.
Yeah, just on the hosting, it's a part of what we call a tier 3 package of services that's on a UNICEF Microsoft Azure subscription. And if I'm not mistaken, the servers for East Africa are in Holland. I hope that answers your question. We have another hand up here. Good. I think Monique. Monique, did you have a question? Did I have the right one there? Somebody's hand is up.
There is
yes.
also another question in the chat. Anton is asking if UNHCR are using Primero or Progress. So in Dadaab, we have both Progress 4 and Primero. So the child protection partners are using CPIMS plus Primero for case management, and UNHCR, of course, they're using their Progress to do reporting for UNHCR, but they're able to download the CPIMS plus reports, and they usually use it for their reporting. I don't know whether they upload it into Progress, but it's something that I know previously when we were starting development of CPIMS, we had talked about interoperability for the Dadaab system, but we ran into some challenges. But UNHCR are able to use Progress, and both also use CPIMS Plus.
That's a good one. We also had a question, or we have a hand up here from Monique. I don't know, Monique, did you have a question for us? Okay. Monique would like to know what's the cause of the high staff turnover, and why the CPIMS makes work more efficient. And just for Ellie's sake, Child Protection Information Management System. But Monique, that's a good question. So Kevin, the staff turnover, is there a specific reason that you can indicate for us?
As I started, I also mentioned Dadaab is a very challenging environment. It's according to even the UN security measures, it's borderline between SRM 7 and SRM 8. So when the staff get to use the system and they get some experience on using the system and child protection, when opportunities arise elsewhere, they usually leave. So it's something based on the will and in terms of even the staff also moving to greener pastures and such. So it's something beyond us. It's not that the system is they're moving because of the system, but it's more of internal or more of progressive career progress for the CPIMS Plus users.
Okay.
And maybe
And
another one could be, as I mentioned, the funding and the resources is also not very adequate. So we are not able to get enough staff to cover all the required, or we are not able to get resources to cover all the needs of the staff. So sometimes also if there are needs lacking, or if the resources provided are not sufficient to provide all the resources required by the caseworker, some might also opt to leave.
great. So just an observation on that one, because I've been supporting Dadaab and Kakuma for quite a long time. And seeing that turnover, this has been a context that's actually informed quite a bit of development in Primero to actually give our system administrators and supervisors the functionality they need to keep track of their own workforce. So in Kevin's first slide, you saw there that that's 70 different users, one system administrator that's basically responsible for knowing who they are, what they're doing, where they're working, how well they're doing. And so that's a whole other data challenge of it on its own. No person can just memorize and keep that much data clear in their own mind. So I think one thing that your experience is pointing out to us, Kevin, is that we need to do a better job of developing and mainstreaming reports that help supervisors and administrators sort of track and provide support and even target capacity building for their workforces. So it's not just all data about the children themselves that we're interested in. We're also increasingly interested in keeping track and having good data on our users and on the workforce that we're supporting. Just because there's another question in here. Oh, so I'm reading it now. Kevin, can you see that one in the chat? Do you want to respond to that?
Yes, I can see. So for the caseworkers that require or are required to do case management have access to the system, not only the case managers and their levels in terms of the approvals. The case managers usually approve the cases done by caseworkers. So all of them have access. And yes, if they're required to do follow-ups and they receive it as a comment within CPIMS, then they're able to do follow-up. And the web system, it can be accessed by mobile and can also by laptop, by mobile device, by tablets, and all that.
Great. We've got a pretty full agenda, folks. I'm looking to see if there's any other questions for Kevin before we keep moving on. I'll give it 1 second. I'm going to just share one more insight. So I see in your pain points here, and Kevin and I spoke about this before the presentation. There's definitely some of the need that we have here is for more dynamic reports. So we're interested in the same specific data points, but over time, those data points change. So filtering on dates and on periods, specific intervals is really important, especially in contexts like Kevin's, where there's turnover. We have, for example, all sorts of different climate based migration. We have conflict based migration. So caseloads can peak and they can change, and dynamics can change very rapidly, and having better analytical tools for system administrators that don't require such a sort of flat table approach is a really important insight that Kevin shared with us. These specific periods and specific indicators, I've worked in these contexts before, and I know what it's like when you have hack reporting. You have the AEU as a donor, you have GIZ as a donor. They all have different requirements at different periods of the year, And having to basically have the same reports for all of them is just not practical. So I hope towards the end of the next session, we'll see part of the proposed solution for this. And so hold on for just a little bit. And oh, I see somebody's come in. Would it be possible for a case to travel with the child on the move? Okay, so Antoine is talking about route-based programming. Kevin, I don't know if you were involved in this work that we did with the Somaliland and the Somalia teams, but we did with some UK support a couple of years ago, we did pilot and develop tooling for route-based programming. That basically means that the record can be sort of follow the child with a unique identifier. The limitation on that is that the child has to be able to provide and willing to provide information that matches in their next point of contact. So we're not using biometrics, so we don't have the possibility of using a sort of foolproof unique identifier on route-based programming, but we do have some experience and documentation on that, Antoine, that we'd be happy to share. And then Monique has asked here out of curiosity, what's the cause of the system going down? Can you tell us a little bit on the maintenance? So Kevin did mention a little bit about downtime previously, Monique. He mentioned that the load time on the CPIMS and low bandwidth and low connectivity can be a challenge. Did I miss anything on that, Kevin?
Yes, that was it. That was it, Robert.
Okay. So as much as possible in places where the connectivity is not consistent, we encourage the users themselves, so the caseworkers themselves, to use the field mode that we've implemented, and that basically allows you to work completely offline without your application, without your device searching for internet until you get back to a steady signal. And that just means that it's a much better user experience for. I think we've all been in places before where the internet comes and goes, and then your application is constantly trying to sync, and sometimes that's more problematic than just working offline for a period and then going back to like the office to sync your data. So that's what we're encouraging partners in contexts like that to do. We should get moving along. Want to say thanks very much for Kevin for stepping up. I sort of nominated him to take part in this data challenge because he was coming to us with a series of requests he's been facing. So I'm glad you were such a good sport about it, Kevin. And please stick around so people can ask some more questions towards the end. The next step in our agenda here is I want to introduce colleagues that are sitting across the table from me here in the room to talk a little bit about SWIMS, this now famous Primero implementation in Ghana. I'll get my colleagues to introduce themselves and take it away.
My name is Kingsley Owusu. I'm the Ghana National System Administrator.
Okay, greetings to you all. Abena Dufie, and the head of monitoring and evaluation, and also the SWIMS National Fees Manager.
Right.
Okay, so thank you very much. So starting on what social welfare information management system is it for us in Ghana? It's also a child protection information management system. Basically, for us, SWIMS is a digital case management system which can securely collect, store, and manage and share all cases relating to child protection. And it's able to do so based on our case management standard operating procedure. And for us, the social welfare information management system is very integral to the integrated social services in Ghana. This means that with the issues of case management, it's not only related to the Department of Social Welfare, but other key sectors are also on board to help provide social service intervention. SWIMS is powered by Primero, and for us, in order for you to have a well-established child protection information system like SWIMS, it has improved our data for case management system tremendously. We moved from our paper-based documentation where you document a case in the past and then issues relating to follow-up or getting statistics, you have to be counting inside your notebooks or with papers, knowing the total number of data or statistics that you have on child protection issues. But rather, with the help of SWIMS, it has now allowed us to have a stronger data tracking system. We are also able to see cases with respect to disaggregation and then trend analysis. We are also able to monitor our cases and get real-time data with a click of a button, which has helped in reporting tremendously. We are also able to transfer or refer and also refer cases as well. When it comes to the users, currently we have the Department of Social Welfare and Community Development being the largest user net. We have currently 170 metropolitan, municipal, district assemblies user nets, and all these people are government officials. We also have officers or workers in the hospital who are social workers, workers in the probation centers, workers in the government shelters, and workers in the domestic violence and victim support units also using the system. We also have some NGOs and CSOs also in this category using the system as well. But when it comes to SWIMS, there's a need for you to undergo training. So usually they undergo online training before a face-to-face coaching so that they can adequately understand what the system is all about and use it effectively. And then when it comes to SWIMS, it's key when it comes to IT infrastructure. So with the help of the integrated social services, an IT infrastructure is in place for them to really purchase some laptops and key modems or internet accessibility for them to document cases effectively. So this is a picture of how our protection concern looks like. So we have a broad category of cases, which is our primary protection concern, and it is 7 in number. And then we have our secondary protection concern. So this is just a pictorial view of which it's also a sticker. This guides the caseworkers to easily identify what cases it is so that they can document it in SWIM accordingly. And then if there are other specific violations, sometimes they could be multiple in nature, they can also select. So we move on to our case categorization. So with our types of cases, we have 7 main protection concerns. So we have the sexual and gender-based violence cases. We have adolescent pregnancy and child marriage cases. We have child labor, human trafficking cases. We have children in conflict with the law. We have cases relating to violence, abuse, custody maintenance. We also have children without parental care, unaccompanied or separated. And then we have persons with socioeconomic vulnerability. So these are the 7 broad categories as are now that in terms of the protection concern that caseworkers document. And as of today, we have 25,455 cases that have been documented in SWIMS, of which 622 are closed cases. We are also able to now tell the number of users in SWIMS. So as of today, we have 1,150 users in SWIMS from various agencies. So we have about 15 agencies as of today. This enables us to have a benefit in terms of SWIMS because we are able to see the full picture of child protection situations in Ghana. And as we are able to see it in Ghana, we are able to see it across various levels. So that of the district level, that of the regional level, and then that of the national, of which we see the broad full picture. We're also able to quantify the workload of our social workers in terms of the workforce. So each caseworker, in terms of whatever case they document, we are also able to see. And then if we are able to see cases that are predominant, of course, it helps us with our planning and budgeting as well. And then this also serves as a means of verification for officers, because once you are able to document cases in SWIMS, you can even see from the change log audit log, seeing the time with timestamp as and how you, when you documented the cases in SWIMS and all of that. So it also serves as a means of verification to us. And then the next slide shows one of our main benefits of SWIMS. So we moved from the paper, they could easily get missing, to now documenting cases into SWIMS, of which we can get information with a click of a button. So in Ghana, why is SWIMS so special to us? So one of the key things is that it has helped the social service workforce. This has enabled our case workers to prioritize their cases and to also to ensure quality and efficiency. Helping them to prioritize their cases, because SWIMS is also embedded, it's a form of case management, and it takes into consideration our case management SOPs. So you're able to see high-risk cases so that they can quickly attend to them within 24 hours. And for every district, we have the case workers and then the case managers. So the case managers' role is for them to supervise the work of the case workers. So that as the case managers supervise or monitor what has been done, it ensures quality. Then we are also able to have the automatic referral and transfer of cases to other SWIM users. So unlike the first that you might have to carry your documentation or call, just if you have another SWIM user in another district, you are able to refer and quickly work on it. And then for SWIMs, you can also work online and offline. And then we could also use our mobile phones aside our laptops. So first we need an internet to log on. And after you've logged on, now that we have sometimes challenges in internet, you can work offline. Usually, whatever you work offline, it's being synchronized when the lights or when we now have internet. And so people living in the rural areas are able to document their cases. They're also able to have real-time data with a trend analysis function as well. And for us, this is the key evidence when it comes to the child protection results, of which we are able to advocate for support. So to us, SWIMS has really contributed to our national protection system strengthening. It is currently rolled up in 170 MMDAs, as I mentioned, through the integrated social services, and we're hoping to also scale it up nationwide. For this year, 10 districts are coming on board, so we'll be having 180 districts. And for us, before I move on to challenges, I just want to share practically how SWIMS has been able to help us in terms of data analysis. So now you can see that we could go into the system as a form of evidence-based, pull out information of which we are able to serve as decision making. So it means that the statistics we get at the end of the day, we are able to use them for information making. And currently, we also have performance agreements of which we are able to prioritize SWIMS. So you can see that sense of accountability. Each case worker, you know what they are doing and in terms of work. So to us, it has really helped us in that regard. Currently, I've also used in terms of going into the system to pull out data relating to, I just needed a place of origin of some of children in alternative care in 2 regions in Ghana. And as I get the statistics, it really has been able to inform the decision making. So these are some of the features or importance of data usage or data analysis that we are able to get, but we still want more. So for every system, there are some challenges. And so some of our challenges are related to limited internet connectivity in some districts, some level of inadequate computer literacy for some officers. We also have some social workers being overburdened because the same social work officers need to do so much and then at the same time documenting. And then there's the need for more dynamic reporting, of which we have solutions to some of these challenges. Currently, we have WhatsApp platform of which all case workers are on board, and the case managers and then the system administrators are able to assist with feedback and to coordinate the SWIMS implementation, and we are able to respond to them on time. There's also SWIMS spot checks, which is very good because we are able to visit our caseworkers in their comfort zone and then also build their capacity and provide supervision in whichever they find some challenge. A clear evidence is the team, that is the national case manager and system administrator, visiting some parts of the northern sector and giving them some spot checks or coaching exercise. They quickly were able to document a lot of cases in the issues relating to the Sahel that happened in the northern parts of Ghana. I'll pause here and I'll let my colleague give us the considerations and next step of which Ghana is taken. Kingsley, over to you.
Thank you, Abena. These are some few considerations and our next steps in SWIM. So the first one is that interoperability with other systems, like any other system. System doesn't work alone. In national terms, you need to be able to work with other national systems in related areas. And these are some few of the systems that we want to start to integrate with. The first one is the Ghana Labor Monitoring System. The next other system is what we call Single Window Citizen Engagement Service. And it's actually a system that the public used to call to provide a toll-free number 0800 800 800 that then there will be somebody to talk to, report your case. Then the receiver receive the case, report the case, and then send to the appropriate institution for redress. The next item for consideration is SWIM data and analysis. And this also includes quality data. There are some few steps that we've taken to improve upon our data. One of them is the fact that we realized that most of the caseworkers who are entering cases were not selecting protection concerns. So when the protection concern is not imputed, it was making the case meaningless. You couldn't really tell the category of case the caseworker was managing. So in 1 month, about 800 cases that was entered in SWIMS, 300 out of these 800 cases were not having protection concern. So it pushed us to be able to make the protection concern input mandatory field. So once the caseworker starts inputting the individual details and other details and does not select the protection concern, the case cannot be saved. So these are some of the review that is improving the data quality and also supporting the workforce to be able to improve upon their data quality. We're also looking at adding new features. The new features include insight. Now, my earlier reporter reported on the need for more dynamic report, and we think that the implementation of the insight will provide an enhanced report and data analysis and visualization for us to be able to have a better view of the picture, better view of the picture of data that's been entered in SWIMS. So we also want to include registry, and in order to make some lists and improve upon data quality. For example, the list we want to be able to implement the Primero history of having all our residential homes under the registry. So if the caseworker managing a case need to assign a child to a residential home, the caseworker can query the exact residential home he or she want to send the child to, and the data will also be systems. So if the residential home, the spelling of the name, the typing will be consistent because it speaks from a list, and then it will improve upon our data quality and data analysis. So next slide. Yeah, that's an exciting view of the Primero insight that we are seeking to implement. And it tells us, we look at the workflow, look at the data analysis, and we look at, you see on the screen, it tells about the workflow, the period, the range, the case data, the workflow data, the agency, and the user group that's entering the cases. So this can give us a dynamic view of reporting, dynamic view of studying trend, dynamic of looking at data in real time. And we think that the implementation of the insight will provide us the needed dynamic reporting. Thank you.
Thank you very much. Fantastic. So I think that this is kind of like the exciting moment of the data challenge, and that we're kind of announcing that with the Ghana Swims work, we're implementing for the CPIMS a series of dynamic reports. So what Kevin was describing in his presentation was how flat tables are of limited utility when you're in a dynamic environment. The same is the case here in SWIMS. I just wanted to really give credit to this team because they're making us look good. Basically, what Abena was saying was 170 districts out of a total of 261 in the whole country. So that's almost 70% national coverage. That's a pretty exciting scale up. And as the product sort of grows and matures and becomes more essential to the work of the integrated social services, the demand for better reporting and better data analysis also grows. So we've got a great partnership happening with the ministry team here. We're going to be working over the next couple of months to implement this standard set of insights for CPIMS. The one that's on the screen right now is the workflow insights. So this is very specific to the progression of the record through the stages of the case management process. But we'll also be doing insights for transfers and referrals, insights for services. So it's a whole variety of dynamic reports with multiple filters that you can set to slice and dice your data in a way that doesn't mean, lots of near misses, let's say, lots of flat table, not quite seeing the relationships that you're looking for. And I think an exciting thing about what we've heard so far today is this really strong emerging need for quality assurance and support for the workforce. And so you can see here on the right that not only can we identify the specifics of the workflow status in a specific with a specific date range, but we can even identify user groups and individuals. And that just makes this much, much more useful for supervisors and administrators. So we'll open the floor up for any questions that people might have on this. I see some reactions coming in. Let's see. Nangar, you had your hand up first. Why don't you come in? Well, Antoine's just saying, great work to the team. Great to see it scaling up. Kudos to Abena, Kingsley, and the whole team. Keep it up. That's from Antoine. Yeah. Yeah.
Yeah.
Oh, I'm sorry. It seems like, Nangar, your mic is disabled. Let me see what I can do about that quickly. Or for the meantime, people, you could just put it in the chat. I'm trying to do this on two separate screens, so I apologize for the delay, and one of them is in French. Can you speak now? Nangar?
Yes, I got it again. Thank you. Thank you, Robert, and thanks, colleagues, for very interesting insights in the presentation. Just a couple of quick questions. One, that I understand SWIM is housed under government of Ghana. So my question is, what level of access UNICEF has on that system, and if we have a data exchange protocol agreed with the government, and if there are any lessons learned around that, I'll appreciate that. Second question is on the interoperability. The last slide you presented, are you also thinking to link it or integrate it with social protection MIS, especially the LEAP or LEAP 1000 data and the work going on? And the last question about the social services, that I understand that cases are also referred to other services. So what kind of follow-up are in the system or feedback loop is in the Primero, that do you, when you kind of propose or refer the case, so then the Primero, your jobs ends there after referring the case, or you still follow up that case until and unless the family gets the support, and then you complete that case within Primero. So with this, thanks very much.
The last question wasn't very clear to me, but
think-
let me
Go ahead with the first one.
first one. So the government of Ghana, we know that the implementation of the SWIMS is being supported by UNICEF, and we have the system roles, and one of the roles is National Protection Officer, which has access to only statistics. So that is the agreed level of control or access that UNICEF has in the SWIMS. So they are able to access the statistics that SWIMS provide. So the second one, SWIMS, is interoperable. So we are able to integrate with other systems. So we are taking it step by step. We first look at the one that are more crucial. So we've identified that the first two we've mentioned are the main crucial system we need to integrate with, and that's why we mentioned them. As we move ahead, we will integrate with other systems. Thank you. The third question.
The third question was on the different social services that are actually being managed within the system, so service referrals. Obviously, not all of the social services are being referred to and tracked in the system, but maybe you could give examples from those groups of partners which service providers are using. Remember?
Providers in the hospital. So it means that social workers that are in the hospital, and it's Ghana Health Service, they are using. So it's not the Ghana Health Service, but social workers that are there, social workers that are probation officers, and then social workers that are working with the Ghana Police, for example, the DOFS, that's the Domestic Violence and Victim Support Units, are also using the system. So there could be referral from the various districts to these organizations.
To add to what Abena said, we currently have 15 agencies that we identify in SWIMS. And the major one, which is the social welfare and community development, they are the key users. And the social welfare officers or case workers who are in hospitals, who are working with the police, who are working with government shelters and private shelters, who are also others who are working with correctional centers. We also have some other users from non-profit organizations. And all these agencies that are in SWIMS make referrals quite easy for us when they are also using the SWIMS, and we are able to request services from them and with a click of a button. Thank you.
And I'll just add one other point because I think it's important to Nangar's first point about access. So there's different levels of access, but it's important to point out that production is hosted by the government. So in this context, we have a hybrid deployment where the government is hosting the production instance and very much leading that. So this is an exceptionally interesting implementation and a model for lots of other places where there are similar requirements. Couple more questions that came up in the chat. We do have to keep to our time here. We have 2 more presentations and we only have 25 minutes. So I'm trying to answer in the chat when we can. We do legacy data migrations to the question that was raised about importing data from historical data. And then there's this interesting question I think is worth us getting to around knowing about handling cases with social economic vulnerabilities. And how do you have challenges to include them, as most of them are more social rather than statutory. So I think that's a relevant question for you guys, no?
Case management SOPs. For example, we have the intersectoral standard operating procedure, which speaks about the referral pathways. So when there are cases of this nature or relating to vulnerability, social workers' capacity have been built to first assess the case in terms of the category. Is it a high-risk case? Is it a low-risk case? Is it a medium-risk case? What are the referral pathways? Which organization or service providers can I work with? And then they do so beautifully by referring to these agencies. And when they even refer, there's a response they need to get. That will the agency be able to assist them immediately, or they would have to put them on their waiting list? So whichever response is a response. So we are able to also manage these cases in the system as well. And then they fall within the various protection concerns that we have that I outlined.
Great. All right, I am going to get us moving along. I'm not doing a very good job of keeping us to time so far, so I'll try to get ahead of things here. We had a great question on disabilities and how that's managed and classified in SWIMS. I'm going to say let's take that on in the session of the agenda where we talk about disability classification. So we'll share this presentation so you can all take a closer look at it. Feel free when we share this with the list, that we'll also create the new page for the website. You can share your ideas. You can share suggestions for our next data challenge. We do have to move along. So I'm going to have Jan take the mic and introduce herself and quickly talk us through this question on our own key performance indicators for Primero. Over to you, Jan.
Thanks, Robert. Hi, everyone. I'm Jan, and I'm the Primero Deployment and Integration Specialist. I've been working with Primero for quite a while and with a lot of you on the call, so really happy to be speaking to you on this really interesting point. On a quarterly basis, I've been reaching out to all of the system administrators on something what we call our KPIs. And really what this is about is we're trying to ensure that, we want to be able to understand who's using the system, how is it, what is the uptake, and really be able to predict our sustainability. And we want to make it easy for system administrators to be able to share this information without needing to go to multiple places to share this back with us. This is really key because the whole premise of what I'm going to walk you through is us on the Primero team, none of the data that appear in Primero in any of its modules are accessible by the Primero team. So we need to solicit this information, and we want to ensure that it is shared in a safe and consent-based way and aligned with data protection and information sharing protocols. And really, we just want to ensure that we're maintaining the trust of the Primero community. So I'm going to first show you what currently happens in Primero. I'm just going to share my screen and take it away from Robert. And on a quarterly basis, each of the system administrators get a questionnaire that looks something like this, where they're able to enter in their name, and then they get different questions about what's in their implementation, the number of users, how many services have been provided, how many follow-ups have been provided, and how many agencies may be participating in providing case management. So what a caseworker has to do is they log into their instance. So what you're seeing on the screen here is just our demo environment that I'm showing. And every single user has this really cool dashboard where you're able to see a snapshot of the caseload. So each system administrator can walk in to their system and be able to see on their homepage some high-level key metrics. They also have access to a section called reports. So in the navigation, we have this section called reports, and I'm just going to flip to another screen. Sorry, I'm going to flip to another screen. And it looks something like this, where people are able to generate reports based on the case level data, but it's sitting in an aggregate anonymized fashion. So here you can see all the cases within our demo site broken down by gender as well as broken down by age. And there's no personally identifiable information that's available in these types of reports. So it does take a long time for a system administrator to be able to go through each of the metrics that we ask for and report those back to the Primero team for our estimates for usage and uptake. So the new functionality that we're really excited to show you is we are trying to simplify this process for system administrators. And so in order to do this, what we're doing is we've developed a new feature, which I'm just going to switch to a new tab for, and it's going to be called, it's currently called an export, but essentially it's going to be a KPIs export where you're able to select that export and pick a quarter that you want to export. So what that means is you can select for January 1st, so for this quarter of 2024, to the end of this quarter, which might be today, which is March 21st, you're able to enter in a name of your export, and then you can hit export. And this now will only pull information from your instance for the dates that you selected in that field. This now will sit in your exports section of Primero. And then once I download it, I already downloaded it for convenience. It looks something like this. You're able to see how many users you have in your instance, how many are active, how many have been disabled, how many new users, so caseworkers and managers have been added into the system this quarter, how many agencies are participating, and you're able to see the full list of agencies who are using the system for case management. So outside of the breakdown of the users, you're also able to see breakdown of your caseloads. So here you're able to see the number of newly registered cases in this quarter. So because this is our demo site, there's not too much information, but you have 5 new cases that were registered, 4 were open, 1 was closed. You can also see the number of services and follow-ups that have been provided, how many incidents have been provided. And so all of this helps us understand what's happening with your instance. We will continue to not have access to any of your implementations, and this is the type of information that would be emailed back to the Primero team, which we can consolidate and put in our quarterly reporting. So I'm going to actually switch back to Robert's slides and just show you quickly what that quarterly reporting looks like in our Power BI. Great. Next slide, please.
1 second. Oh, it's frozen on me. There we go.
So this is essentially what we're sharing on a quarterly basis with all of our interagency partners and this is what really helps us understand what's going on in the Primero ecosystem. So as of February 2024, we have nearly 70 instances in nearly 60 countries. You can see that we're case managing almost 1.5 million cases across all of these implementations. With all of the implementations, we have over 12,000 users who in just this quarter provided 150,000 services, as well as reported on almost 50,000 incidents. So these are the types of things that we're continually trying to aggregate, and this new export is going to help us in ensuring this is very accurate. Instead of always soliciting this information and asking system administrators to dig around and provide that back to us. So I think that's it on my side, Robert. I don't know if you want to add anything else.
Nope, that was great. Jan spends a lot of time, and so do our system administrators, every quarter trying to create the data sets that are required to do this nice looking dashboard. We aim to, introduce massive efficiency improvements on this and just have much better disaggregation, much better regional, national, and global level reporting on system health and usage. So thanks a lot, Jan. That's fantastic. If anybody has questions, please throw them in the chat, but we do have another guest speaker that we've really limited her time. So I'm just going to move forward and I'm going to jump forward to a discussion with Lucy Richardson. Lucy, are you on the line?
Yes, I am. Can you hear me okay?
Yeah, I hear you loud and clear. You can take over the screen as you need to. We're going to talk about the child functioning module.
Wonderful. So I'm going to share my presentation. Excellent. So thank you for having me. For those of you who don't know me, my name is Lucy. I am disability inclusion in child protection consultant. So very happy to join you today. I have worked quite a bit on Primero, so you may have seen one of my presentations before. So apologies.
We don't actually see it now, Lucy. We don't see the presentation just yet.
Oh, how about now?
Now we do.
Excellent. There we go. Great. So so as Robert said, I'm going to talk a bit about the child functioning module and how it relates to Primero. And so I'll I'll talk a bit about what the child functioning module is, why do we need it, the obstacles to implementing it, and how we could mainstream it and plans going forward. So to start with the immediate question for those of you that don't know, the child functioning module is collects accurate, quality and comparable data on children with disabilities. And we need it because children with disabilities are a larger segment of the population than you might realize. And often they're not being reached with services, including systems like Primero. At the end, I'll go through the particular obstacles and how we can get started on the mainstreaming and all of that. But I like to start with the kind of basic, concepts, and to make sure everybody's, understanding what it is we mean when we say children with disabilities. So I'm just going to move my slide forward. So children with disabilities. On this slide, I have on the right a world map, which is just giving you an idea of how many children with disabilities there are around the world. So I've got the regions in different colors there. You can actually see all of this information in the Seen, Counted, Included data report that we have available online. And the definition is written on the left. This is the definition of children with disabilities that UNICEF uses. So it says that children with disabilities are those under 18 with long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. So the keywords are highlighted there: impairment, barriers, participation. I always like to start out with this because I think it's really important to talk about that before you talk about anything else with the child functioning module, because the focus here is on the interaction between the impairments, barriers, and participation. It's really important to understand like what it is that we're trying to find out about the children. So impairments are other difficulties related to body functioning and body systems. So that might be sensory things such as having difficulty seeing or being blind. They might be physical, intellectual, psychological. Barriers, other things, anything that's preventing interaction. So things that could be physical, communication, they could be systems, they could be attitudinal barriers, so like having stigma or discrimination against disability. Physical things like they're in the buildings or in the built environment. Communication, so things like if you have a only one form of communicating with with your programs, for example. And participation, the third word highlighted there, is just about being involved in the environment and activity and community equally with others. So for children with disabilities, on this slide here, I've just got a range of photos of different types of children with disabilities from different contexts. They're using different types of assistive technology, so anything that's helping them move around their environments, things like canes, hearing aids, long canes for children who are blind. And it's really what to know, as people who be working with Primero, is that children with disabilities are particularly vulnerable to protection concerns. They often have less access to services, but they're often excluded and isolated from their communities. And in cases where they do have access to services, sometimes service providers might not be aware of that child's disability. It's not always apparent immediately, or they might not know what support is required to meet the needs for that child, or how to provide the appropriate services for that child. It can also be really difficult to collect information on children with disabilities because of any barriers in the environment. So that could be to do with how you are collecting the information. If you don't speak the same language as the child, for example, they use sign language and you don't. But especially attitude barriers. So things like social norms or stigma about disability, but also unconscious bias and beliefs that might impact how you interact with children with disabilities or how workers interact with them. So to get your accurate information and data about children with disabilities, you really need to have the right tools to get that information. So what is that information and how do you get it? What do you need to be asking? What do you need to be finding out? And something people say a lot is, well, that's really difficult. Like, how do I do that? Do I need to know about every disability? Like, do I need a list? Do I need a medical diagnosis? No, not at all. Okay, so really remember we said interaction between the barriers, the impairment, that's preventing participation. So what you actually want to know is about those interactions. You want to know about how the child's interacting with the environment. That's where the concept of functioning comes in. So functioning is just describing how the child is participating in their environment and how they experience the world. So that includes if they have the impairments and if there's barriers. And so in this photo, as I said, we've got lots of different children. They're all going to have unique experiences. And talking about that builds a picture of who the child is and what services they might need. So the child functioning module, it's right there in the name. It's all about the functioning. So the next slide I will put up. Sorry, this slide, for those of you who are looking at this slide is not as colorful and interesting, sorry, but it is just a very basic copy of the an outtake from the original draft of the child functioning module itself. So it's a set of questions asking about disability, and the way that the questions are framed is it's asking about functioning. So the child functioning module is actually 2 sets of questions for different age groups, age 2 to 4 and age 5 to 17. So it's actually UNICEF and the Washington group came together to form these questions, and it's really trying to collect as much information as possible across different what we call domains of functioning. And those areas of functioning were chosen because they're both basic and universal, and that they're common across many different countries and cultures and recognized across many different languages. The questions are asked of the parents or primary caregivers, and they compare to peers, so it's children of their age group. So the way the questions are formatted say, does your child use any equipment compared to their peers with this equipment? Would you say they have difficulty doing this activity? So the answers are a continuum from mild difficulties to major impacts. So really they're looking at the presence and extent of difficulties in functioning rather than like the cause or the label. So again, it's not about being an expert in a diagnosis or anything like that. So on the next slide, I'm going to show from the UNICEF data report is these icons show some of the different categories of functioning that are included in this child functioning module in the CFM. So it includes things like seeing, hearing, communication, playing, learning. So just to give you an idea of the kind of data that is being collected when you use the child functioning module. So you can see how it really builds up a picture of a child and how they're interacting with their world. And this one is for the children aged 2 to 4. On the next slide, this is the ones for the children aged 5 to 17. There are more areas covered here. And just to note, of course, we can share the links and you can go through all of this, but I won't spend too much time on it, knowing we have less time. So quite a lot of areas covered here. So of course, now the obstacles for using the child functioning module, perhaps you've already guessed it just by seeing all of those functioning areas there, is that it is quite thorough. I mean, it is very thorough. And perhaps when you saw, if you were able to see the way that the questions are formatted, if you have those questions presented in the full list format, it is quite, it does appear quite intimidating. There's certainly, it's certainly perceived as being quite complex when you look at it all at once, basically. So that is certainly an obstacle, and that has certainly been the case for feedback on the child functioning module in its use in general. But we certainly feel that is a challenge for it in the context of Primero. The module itself is not complex in the sense of that it's a very complicated thing to understand. Like once you have once you have the questions in place, there's very, very clear, instructions on what it means and like how to use it. And I think, Robert will go into a bit more detail on possible future plans for this, but it is certainly, I think, it is certainly a challenge on how it first appears. So there's certainly some exciting ideas about how we could use this in Primero in a way that is a lot easier for the user, because it is a really incredible tool to really capture this group of children who are so often being overlooked and not being captured in Primero, even though they are certainly out there. And the other obstacles that we've really identified is that, firstly, related to the perception of it as being a complex tool, this is certainly not an official label, so don't quote me on this one, but I've called it intersectional fatigue. It's just the idea that people are being asked to do more and more things, and it is certainly feeling like, I think, for a lot of people, that they're being asked to disaggregate this and label this and disaggregate by this and disaggregate by that, and it starts to feel like more and more things are piling on. So to try and mainstream and seamlessly integrate into what you're already doing is certainly key. I think time pressures, of course, particularly in challenging contexts, as I heard about, in the first speaker from Kenya, in really challenging contexts. I think that's key. And then, of course, just the awareness of the child functioning module, of why it is the way it is, of how it works towards disability inclusion, and then just, skill in applying and using it. So I think I'll pass to Robert if you want to add some comments there, and then we can open for questions. Thank you.
Great. Thank you so much, Lucy. We've just really enjoyed working with Lucy over the past couple of years. One thing that is abundantly clear to me is that with this great network and the great community of practitioners that we have in our Primero community, that we can really make a difference in some of these. We can be a leader. So the child functioning module, in my personal experience with it, when I first looked at it, it's a long list of questions, and they can seem quite complicated. But that's when you see it on paper. That's when you see it on a page. And a flat piece of paper in text, you can see in this one question, or these two questions here, that this is perfectly applicable for skip logic functionality we already have. So instead of a potential caseworker looking at a long form that they have to scroll through 3 times just to get to the end of it, skip logic makes this very tidy, less intimidating. We can include all sorts of help text and guides so that we can help actually develop the capacity of the frontline workforce to actually implement this. I think it's a great opportunity, and we're going to be working a lot together in the coming year to both implement this in Primero and come up with a strategy for how we can both introduce it in new contexts and into existing Primero implementations where they would benefit from it. So I know we're a little over time, but I really want to hear if we get some questions in. I really appreciate Lucy making the time for us. I keep coming back to her, ask for her time. So fire away with any questions you have. Please go ahead. Does anybody have any questions on the child functioning module?
Great. I think I thought I saw a hand before, but maybe I missed.
Up and down hand?
There was also an earlier question on disability, maybe, Lucy, that you could answer. There was one from Ellie. Sorry, I'm just bringing it back up. This was in reference to SWIMS, but they had asked, among the cases you had mentioned, what's the biggest? What can you share with us about the cases of children with disabilities that you usually meet? Are caregivers or guardian reports actively, I assume, collected for safeguarding cases and concerns for children with disabilities, or only those without disabilities? And Ellie, sorry if I misconstrued your question, but please feel free to also come on top of that.
Yeah, maybe if you want to, Ellie, if you want to, I don't know if people can open their mics or not.
I'm working on that right now.
Okay.
Ellie, your mic is open. If you want to use it, I think Jan just beat me to it. I think we have a delay here. Ellie, please come in. Geez, Jen, I think are you doing the same thing and I'm?
Okay, I think I'm now
No.
audible enough.
Thanks.
Okay.
Yeah, thank you so much. In the first presentation that provided about the case and the referral related things, I was curious to know whether there are some cases that you have identified about children with disabilities, and what about those cases? Because I also work with children with disabilities, but mainly you find that in the community, it is rare for the community members, even caregivers, to report the case related to children with disabilities, because when they report that, they are not supported because the community say, you are reporting this case about this child, yet he is useless, he does not have any future. So that is an experience that I experienced. So I was curious to know about that. That's why I asked that question. I thank Lucy also for this presentation about the child functioning model. So I was asking whether we can have this tool or this module on the link that's shared. Probably I'll check the link shared where we can probably get this tool, this module, and learn more about it. Thank you so much.
Great, thank you. So it was specifically a case where the reports for children with disabilities, sorry, there was difficulty with getting services for children with disabilities, if that's my understanding. Is that right? Yes.
I think that's right, Lucy. Yeah.
Yeah. So no, thank you for sharing that. So that's certainly yeah, unfortunately, that is quite a common issue that we hear about in relation to access to services, and I will say that that is actually part of the reason that the child functioning module is designed the way that it is designed, with the language that it uses, to try to capture the information about children who have disabilities, even if you know, perhaps that has not yet been identified, right? Because of, you know, just being aware that in you know, in a lot of places all around the world, there is still that kind of you know, stigma and discrimination and bias related to disability, and that, you know, the research has shown that when you ask a parent or a caregiver things like, you know, does your child have you know, find it difficult to you know, to walk or to hear or to see compared to other children, that you'll get an accurate answer compared to if you start out saying disability and you'll get an actual accurate answer, so that then the service provider can go on to connect that family or caregiver to services for that child. Whereas if they went with language that, you know, perhaps is going to, you know, be stigmatizing for that family, they're not going to get the information, and then they're not going to get the services. So that's why, you know, you've really hit on the reason why we have this tool set up the way that it is. It, you know, really gets you the access that you need. And oh, I see. I think Robert has been answering the question about where you can use it. And yes, so yeah, you can really use the CFM has been used in many different like it can be integrated into many different you know, parts. And so Robert said it can be its own form component within Primero. And I will say that for UNICEF, it has been added into the mix household surveys as well. So just an example of how it's currently being used elsewhere.
Yeah, even in our very advanced, very mature Primero implementations, we still have completely different classification and reporting on children with disabilities everywhere. Like we couldn't produce a global report even if we tried, because the data is just so incompatible and inconsistent. So it really is a problem that we need to be proactive about. We have the framework that we can work with. We have the community and the means to do it. So we're really going to put our heads together this year and come up with a strategy to support this.
Yeah, and it's also, I think it really helps to think about it as you're already finding out, you know, about this child and this family, like, you know, what their circumstances are, what their situation is, and this is just another, you know, another aspect of who this child is and, you know, what this family situation is. So it's really just giving you a fuller picture of what their support needs are, and yeah, you know, how you can ensure their protection and their support needs are met at this point in time. So yeah, I think it's really, you know, really exciting moment for us, for Primero, trying to get this CFM fully mainstreamed and implemented. Thanks, Robert.
We already have some countries that have lined up to sort of pilot with us. So in the coming months, we'll just keep your eyes on our publications, our websites, and our channels, and we'll be announcing as we go. And obviously, looking for collaboration, looking for cooperation from everyone. I realize that we're already 10 minutes past time. We're starting to see our numbers fade a little bit. Lucy, next time I promise I want to put you at the beginning of the agenda, because I think I've done this to you a couple of times, or I've left you at the end and short on time. But very exciting. Thank you very much. I'm just going to present one last slide before we go, because I do want people to get a quick look at something. Well, I'll share these slides with you, but I do want people to understand that part of what we're doing with the data challenge is we're trying to assess how we can provide better services to the field. So two things I wanted to share. The new digital principles have come out and they've been refreshed, and there's a very clear evidence component to them. So I'll share this link, but I'd like you to take a look at this, and I'd like us to start also mainstreaming some of the concepts in the digital principles. The real basic concept is that we have an obligation to use the data that we're collecting. We have to do it in a safe and secure way, but data usage is a part of our work. And increasingly, I think it's an area where we need to be just a lot more proactive. We have lots and lots of data that's not being actively used to improve programming. And I think that's something that we need to correct in our collective work. The last thing I wanted to share, I will share these slides. There's this Primero DAO. I'm not going to have time for that now, but I am going to put this survey link in the chat. It's a 5-question survey, and it's also a request. If you want help from us, data visualization and support services, please do fill out the survey. This will help us position resources and make decisions that serve our community best. Thank you all for coming and participating. Thanks very much for all the teams that contributed today. I think we're going to land on we're going to start announcing the date of the next data challenge each quarter. So we're going to aim for the end of June for the next one. Get your ideas in, okay? Finish the survey for us and get your ideas into us, and we'll do our best to make sure that we're taking your needs into account when we're making decisions about the services that we provide. So with that, I'm going to close my screen. I am going to thank everybody once again for joining us today. Special thanks to the presenters. And we'll see you all at the next data challenge. Over and out from Accra, Ghana.
Thanks,
Bye,
everyone.
everyone.
Thank you. Bye.